If you've had spinal surgery or someone in your family has, then this is for you. Because surgery doesn't happen out of nowhere. There's a long story that leads up to it. And almost every time, that story starts with the subluxation. Here's what I see every week in my practice. A patient comes in with an MRI, a herniated disc, stenosis, severe degeneration, and they look at me like this came up out of nowhere, but it didn't. When a bone in your spine is subluxated, locked out of its normal position, not moving right, the disc between those segments takes an abnormal amount of stress. Not once, every single day for years. And worse if you're active. That disc doesn't fail because of one bad lift. That might be the moment you felt it, but the disc was already worn down long before that. Uncorrected subluxations of the spine did that. So when the damage gets bad enough, surgery is the next step. And there are 3 procedures I want to walk you through today. Now this is an anterior cervical fusion. The surgeon goes in through the front of the neck, removes the damaged disc, and fuses 2 or more vertebra together with the plate and screws. You can see the hardware right here. Now that segment now is one solid piece. It'll never move independently again. This here is a disc replacement. Instead of fusing the segment, they replace the disc with an artificial one. Same concept as a hip or a knee. The idea is to preserve some motion. Now you can see the implant sitting right where the natural disc used to be. This doesn't resolve the degeneration or the stresses that produced it in the area, but it's definitely the better alternative. And now this is a laminectomy. The surgeon removes part of the lamina, the back portion of the vertebra, to open up the spinal canal. It's a decompressive surgery. It's done most often for stenosis when the canal has narrowed and is compressing the spinal cord or the nerve roots. Now here's what most people never hear. None of these surgeries fix what caused the problem. It doesn't fix what caused the symptoms. The fusion locks a segment, but the levels above and below it are now taking on more load. If those segments are already subluxated, they're going to break down faster, which means that degeneration is going to continue to creep through the spine, leading you down the road for more surgery. The disc replacement at least preserves motion, but motion in the spine that still has uncorrected subluxations is going to still create additional and advanced wear and tear. The laminectomy opens the canal, but it doesn't change the mechanics that causes stenosis to develop in the first place. Surgery addresses what happened. Chiropractic addresses why it happened. And I want to be direct and clear about something. Transparency maintains friendships. Having surgery does not disqualify you from getting adjusted. I adjust patients with fusions. I adjust patients with disc replacements. The technique is different. I work around the hardware. I respect the surgery, but the spine above and below the fusion or the disc replacement still needs to move, still needs to be checked, still needs to be corrected when it's subluxated. Because if we ignore the rest of the spine after the surgery, you're watching the same breakdown repeat itself on the levels that weren't operated on. It happens more frequently than you know. So if you've already had surgery or you feel like you're heading towards one, I beg you to please come in. The best time to address subluxations is before the damage is done. The second best time is right now.